Hello, I'm Sanjib Kumar Sharma, Professor of Internal Medicine and Cardiology at BP Koirala Institute of Health Science. And also, I'm a founding president of KHDC Nepal, that is a program for prevention, detection, and management of kidney disease, hypertension, diabetes, and cardiovascular disease. Today, I'm here to talk about lifestyle, the cause, and the most effective treatment for hypertension. We have heard that our Rishi Muni used to live long. Let me go to the mythology. Is it true? Yes, this is. But have we ever thought why Rishi, who is practicing the life of simplicity, used to be healthy, happy, and wise? Look at their way of living, their physical activities, their food habit, meditation for peace of mind. However, we change. We call it modernization. During this modernization practices, our physical requirement increased. We need vehicle to move from one place to other. That led to sedentary lifestyle. Even in the malls or buildings, we have lift and accelerator. Requirement in the job and family front increase. That is leading to stressful life. In other words, we are living a habit or lifestyle that is changing to sedentary, stressful, and competitive living. All of this led to an increase in the incidence of conditions or disease such as obesity, dyslipidemia, cardiovascular heart disease or heart disease, diabetes, hypertension, cancers, and behavioral problems, and that, unfortunately, even among the young people. Due to their association with unhealthy and inappropriate lifestyle, the name lifestyle disorders is given to such diseases. One of the most common lifestyle disease we know is hypertension or high blood pressure. But often it is not seen as a culprit until a serious medical problem appears. We call hypertension a silent killer because it produces serious damage to our body or even takes away life without prior ailment or symptoms. It suddenly strikes us. It can permanently damage our heart, kidneys, brain, eyes, blood pipes of the legs, etc. But the good news is that, like most of the lifestyle disorders, hypertension is preventable and even reversible to some extent. Usually, before starting any blood pressure lowering medication, people with high blood pressure or rising blood pressure are advised to make healthy changes to their lifestyle. They are advised that they should follow lifestyle which is healthy. In fact, at times, no medication is required at all, provided the changes are adopted, that is, healthy lifestyle changes are adopted before the rise in blood pressure becomes irreversible. If we practice healthy lifestyle before too much damage occurs, it is reversible. Now, question comes: is yours lifestyle is a healthy lifestyle, or because of unhealthy lifestyle, are you at risk of developing high blood pressure or other chronic conditions? There are a number of daily activities or practices that collectively constitute an unhealthy lifestyle. Remember, if you are following in any of the following conditions or activities that I am going to pronounce now, you are having an unhealthy lifestyle. Number one, if you eat more calories, or in other words, if you eat more food and spend loss of it. I will come to this again. You are fond of salty foods, especially processed and packed food. We often call them junk food. You are following a sedentary life activity or doing a minimal or no physical activity. Are stress at work or home? It is time to change them. Now, question is how to improve your lifestyle. It's not so difficult. You have to make your mind, and you can focus on several aspects of your lifestyle so as to achieve an healthy output. We'll be discussing 5 healthy lifestyle today. Diet. Let us talk about food. Eating a healthy food. What food is healthy for our body? To help manage your blood pressure or to prevent you developing blood pressure, you should limit the amount of sodium, that is we call common salt, that you eat each day. That should not be more than 5 grams a day, and increase the amount of potassium in your diet. Potassium is high in content in citrus food and green leafy vegetables. It is also important to eat food that are lower in fat, as well as plenty of fruits, vegetables, and whole grains. You can make an habit and fix a few key goals, like try to find out which vegetables you like most and choose and eat them more frequently and more in amount. For example, you may like broccoli or carrots or radish, which are quite high in fiber containing, which are good for health. Eat slowly. We often call that chew slowly, as we have 32 teeth. We should grind our food 32 times. It says so. It's an ancient saying. And use small portion size. Take little amount. It is said that eat like bird. Consume primarily food that comes from plants. Plant-based food are healthy for human being than animal-based food. So therefore, limit or avoid consumption of animal-based food and give emphasis on plant-based food. Limit alcohol. People say limit alcohol, but I often advise not to take alcohol or avoid alcohol, because I believe that any amount of alcohol is harmful to body in one or other forms. Now come to the physical activity. Essential every day for a person to be physically fit in terms of health. A common myth is that exercise is beneficial only if it is exhausting. That is not true. But in reality, any movement is good and lower level of daily activity is beneficial. It is said that something is always better than nothing. The best advice would be do something fun that involves movement. Combine physical activity with other activity. For example, you can do dancing if you like it. You can do speaking, skipping, but socializing is also advisable. But at the time of COVID, probably we need to take care of this, and socialization is not so good as COVID may spread. And realize that multiple short episodes of physical activity are equally beneficial. Someone is very busy, cannot devote a time of 30 to 60 minutes. If you cannot devote that long time, you can break your spell to 10 to 20 minutes for 2 to 3 sessions each day, and that will give equal benefit. And what is brisk exercise or moderate exercise which is beneficial? we should you should know that if you are doing exercise and feeling short of breath and you cannot sing continuously, that denotes that you are doing very good amount of exercise, that is moderate activity is in place. Now come to the weight, the third one. You should set long-term goal to prevent further weight gain. And if you are overweight, reducing body weight through both dietary changes and physical activity is recommended. Moderate weight loss can significantly reverse weight-related metabolic problems, including high blood pressure. It is advised that you should weigh yourself regularly at a interval which is feasible to you, maybe weekly, maybe monthly. Learn to live with a small amount of hunger during the day. I will give you an example here. How we should think it. Think of bank balance. If we put 100 rupees each day in the bank and spend 99 rupees, every day there will be 1 rupees extra. But if we are overweight, we have more bank balance, that means. And if we spend 101 rupees, in other words, if we do more exercise than what we consume, you will be able to lose weight. So remember bank balance and do regular exercise. That means take less than you spend so that you can reduce weight. Realize that it may not be possible always to reach the goal, but do not lose heart. Focus on long-term progress. It is not for 1 day, 1 month, or 6 months. It is a long-term goal. So weight reduction or maintaining a good physical body weight is very essential, and focus on reducing weight if you are overweight or maintaining body weight if you are normal weight. Now come to the fourth, that is sleep. It is advised that you take at least 7 hours of high quality sleep per night. It is myth that you can make up for your sleep deprivation by sleeping in on the weekend. In reality, any reduction in sleep can have unfavorable health effect. Sleep is very important for body. Sleep is important to repair our body. When we sleep is very important because during sleep the body is repaired, because in day-to-day activity every day in daytime our body is injured, seen, unseen, micro injury, and the during sleep the healing process takes place and injury is healed. Similarly, brain also take rest during sleeping, and it helps to consolidate memory that we acquire during the daytime. Therefore, sleep is very important. The best advice will be to adopt a regular schedule for sleep with no more than extra hour on weekend days. Reduce distraction before sleep. Please put away your mobile phones and other gadgets and turn off your television. That is very harmful, and turn off at least 1 hour before sleep. Reduce distraction while sleeping. That is minimize light and noises during sleep, because this is also known as sleep hygiene. Therefore, clean bed sheet, noiseless room, and not using mobile phones or television at least 1 hour before sleep, and sleeping adequately at least 7 hours a day is very essential for good health. And finally, stress. In long-term goal, you should incorporate at least 30 minutes of relaxation and contemplation into your day. Stress is natural reactions. When we are born as human being, we are bound to get stressed, but we can manage it by developing a skill to cope with outside pressure. And it is possible to react with resilience. Just to give an example, if we throw a cockroach on different people's body, you know that the reaction to cockroach in their body will be different. Someone will even not bother and just pick up the cockroach and throw away. Someone will scream at it. So it is stress is same for all those people, but the reaction to it is different. So develop a calm and quiet reaction to stress. There are numerous practices that can be beneficial, such as yoga, taking a relaxing walk outdoors, or developing a mindful based stress reduction practice, listening music, etc. In other words, take action that is relaxing to you. The bottom line is to make time to consider whether you are on target with each of these lifestyle goals. If not, reach out to your physician or other trusted resources to help develop a plan to take this important step to improve your health. High blood pressure, like every lifestyle disorder, poses two choices that many people find distasteful: live with positive habit or resign yourself to taking medication as you grow older. All lifestyle options are a matter of personal choices. Therefore, we often call high blood pressure and other lifestyle disease as diseases of choice. Moving in the right direction does not need to be drastic if you start early enough. Stay in your comfort zone while reassuring yourself that zone can expand until you reach your ideal goal. Remember the simple goal of life and choose the simple ingredient of life, that is good healthy food, do regular exercise, drink plenty of water, expose yourself to sunlight, restrain from taking tobaccos and smoking or taking alcohol, go to fresh air, have a good sleep, and of course, pray God. So I often tell my patient and other people in the community that you should follow 5 or 6 conditions, or I often call them medicines, that these are gham, pani, parishram, ahar, and bihar. Gham means sunlight, get expose yourself to sunlight. Pani means water, take plenty of water, at least 8 glasses a day. Parishram means physical activity, whatever activity you like, jogging, walking, dancing, skipping, you do it 30 to 60 minutes of moderate intensity. Ahar, that means food that should be healthy, take less salt, take more green and leafy vegetables, try to develop a habit to live on plant-based diet, and vihar means relaxation, including good sleep. And not le- last but not the least is pray or believe in spiritual health and enjoy healthy life. Thank you very much.